Joining us right now is Texas Republican Congressman Louie Gohmert. Congressman Gohmert, it's good to see you again. Thanks so much for joining us.
Always good to be with you, Maria.
Where does this stand in your view?
Well, I was hoping that the Senate was going to get a vote before July 4th. I told the president a few weeks ago that this was feeling like 2005 when Dennis Hastert and Bill Fritz in the Senate had slow-walked the agenda so that it didn't happen. They got to the even-numbered year and yelled, okay, it's an election year, can't do any of those things. And I don't believe the president's going to accept no for an answer, thank God. There are too many people, as you've already been talking about, they are hurting from Obamacare. And despite all the lipstick that the Democrats put on this pig, it's still a pig. But it is causing so much suffering. And so we have got to get this done. It can't be about politics. We've got to get it done. And it can't be just a dressed-up bill that doesn't bring down premiums and give people choices, get them the doctors back that they had before. So it's imperative that the Senate get a good bill passed, and we can work it out from there. But you were talking about tax reform earlier. You know what that will mean for the economy. We have got to get that done. You know, some people are holding on to the border adjustment tax. We've got to do that. And, you know, they're saying, and we need the savings from the health care bill so that we use that. Look, Arthur Laffer is exactly right. This is so important to our economy that we need to say to CBO, any entity that's margin of error is plus or minus 200 to 400% doesn't get to score our bills. We don't care what you say about the score on our tax bill. We know historically this is going to do wonders for creating jobs, having people making more money, and we are not going to let you kill this bill.
Are you ready to forego your upcoming August recess to get a deal done? If you don't get something done, you're committed to not going on vacation for the August recess. I've done
well, and of course, it really isn't a vacation. I love September because August means people have got to go back and face their constituents, and then we get some good stuff. They come back going, wow, I didn't know they were so upset about that bill. Yeah, that's what we've been telling you.
But you make a really good point about the CBO, Congressman. Mary Kessel, that's what you mentioned earlier. But why are we so wedded to the CBO number here?
Just forget CBO. Let's do it. Let's cut the taxes. Let's get the corporate down to 15. Let's get the personal income tax level down. But I have drafted a letter that says if we don't get a health care bill passed into law, if we don't get tax reform passed into law, we need to forego going home for August and just stay here till we get it done. And many of us are committed to doing just that. It's that important for the country.
Congressman, you've got some conservatives who are ideological purists. I'm thinking of Rand Paul, seems to care a lot more about making a point rather than making policy here. Obamacare is a fact of life. You've got millions of Americans who only have one insurance provider or maybe even no insurance providers. Politically, it doesn't seem like it's an option here to just repeal Obamacare. You've got to replace it with something. Do you agree? And if so, what do you want to see in this bill?
Well, I want to see the repeal. We've done that so many times already. We've even gotten it to Obama's desk. But even just a repeal will get us back to some free market forces where we drive down the cost.
Yeah, but you're throwing millions of people off of health care.
Oh, my gosh.
That's
Don't tell me you believe CBO.
For 2018.
CBO says 26 million will lose the insurance they got. Are you kidding me? We hadn't had 26 million get insurance that didn't have it before. So many have been driven to Medicaid, and it may get them off Medicaid and get them onto a good private insurance. But CBO, again, on the health care, they were so wrong on Obamacare. They missed it dramatically.
So you're arguing that if you could just repeal Obamacare, not replace it with anything, millions of Americans with no insurance, you don't think Republicans would pay a price next year at the polls?
I think that Well, if we can hurry up and get the repeal passed, I don't think so, because I think we'll see competition. But let me also say, a lot of folks, including me early on, said, let's buy across state lines. That is not a remedy. We buy across state lines, then you're going to have one monopoly for the whole country. But, and I can see Blue Cross and others saying, yeah, that sounds good to us. But no, what we need to do is what we did in the House. We passed a very bipartisan bill that ended the exemption from antitrust laws for health insurance companies, so they can't violate the antitrust. They cannot monopolize.
Right,
if we don't repeal that, there's going to be one big insurance company and people will go nuts.
Here's what your constituents and voters across this country are hearing. You're arguing to not believe in numbers out of the Congressional Budget Office.
Yeah,
people,
again,
like you're arguing points that don't connect with people who are worried about their premiums going up, their deductibles going up, their out-of-pocket costs are going up. They don't have choice. They've really lost choice in terms of insurers, in terms of their doctors. That's what you've got to talk to, and you have to tell people how you're fixing that.
Yeah, well, the thing is, if we can get it done now, where there's a year and a half before the election, then people will see how much good they have gotten. They'll see the choices that have come back. But the president has made clear there is going to have to be some type of replacement. That's what he promised. Most of us didn't promise that. We promised to get a patient-centered, affordable health care back into existence. So there will be something in there to make sure that people's premiums come down. They do have choices. So that's going to be the big negotiation. But, yeah, the thing is, if we go ahead and just bite the bullet and do that, the tax reform, the health care reform, repeal and replace, then people will have enough time to see CBO. They were right to forget them. And this is one of those things that takes real leadership. It takes guts. Stand up and do the right thing. And a year from now, people will be able to look back and go, well, I wasn't sure a year ago, but a year ago, these guys did the right thing. They had the kind of courage that we want from our Congress. But if we just go this mamby-pamby, oh, we're not sure, we're afraid, oh, CBO gave us a bad score, forget CBO. Do the right thing, and it'll pay off in real low premiums and pay off well at the ballot box as well.
Are you going to have the same issues and battles over tax reform, you think?
Yeah, I mean, it goes back to CBO. Why do you think there's such a push for a border adjustment tax? It brings in money, and so the score doesn't look so bad.
Right.
Forget the score. Laffer's right. It will do so much for the economy. We just need to do it and watch the economy soar.
Congressman, thank you very much. Appreciate it.
No, thank you.